The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
Diabetes is like a roller coaster. It has its ups and downs, but it's your choice either to scream or to enjoy the ride. Good evening and welcome, dear friends. This is Meenakshi Sharma back again with yet another new episode of BMC Global Live Al Hilal Health World Nothing But Lifestyle. In this talk show, we have highly qualified and expert doctors with us to share their valuable knowledge and information on different medical topics so that our viewers can get maximum benefit out of it, because our priority is your good health. Pregnancy isn't always that easy. The extra emotions, fatigue, morning sickness, and difficulty in finding a suitable and comfortable position to sleep every expectant mother faces. But the thought of that your child is growing inside you is one of the most rewarding experience a woman can enjoy. At the same time, it is important to visit your doctor for your regular health checkups to avoid any health issues or complications. Dear viewers, diabetes is one such serious disease, or it is a condition in which the blood glucose level goes too high. It can happen when the body is not able to produce enough insulin, or the insulin that is produced is not that effective. This diabetes, if it occurs during pregnancy, can cause problems for both the mother as well as the baby. To throw more light on this topic, that is diabetes in pregnancy, we have with us in our studio Dr. Aisha Anjuna from Al Hilal Hospital, Rifa branch. She is a specialist gynecologist. She has done her MBBS and DNB in obstetrics and gynecology. She has more than 9 years of experience in managing female gynecological problems and high-risk pregnancies. She has experience in infertility treatment, including IVF cycles and artificial insemination. So, let's welcome her. Good evening, Dr. Aisha, and welcome for this show.
Good evening, Meenakshi, and thank you for giving me this opportunity.
Thank you, Doctor. Doctor, as you know, today's topic is diabetes in pregnancy, which is very important. So, first of all, we would like to know what is gestational diabetes and how it is different from other diabetes.
Generally, we all know about diabetes, and there are two types, type 1 and type 2. Type 1, which is seen in younger children, and it is diagnosed earlier, and it is because of there is less insulin in our body, production is less. And type 2, it is seen in elderly, maybe about 35-40 years, and who are in obese patients, obese population, and this is because of insulin resistance. But more important thing is the gestational diabetes, which is seen in pregnancy and which affects the baby who is in the womb, and that baby when in future can have this diabetes or obesity in the future. So that is why gestational diabetes is important, and the gestational diabetes is something that abnormal blood sugar which is diagnosed first in the pregnancy.
And how many women are affected because of this, and in which month usually it is seen?
The prevalence of diabetes is increasing. Earlier it was less than 4%, and now it is around 15 to 17% in general population, and it is most often seen after 20 weeks of pregnancy, that is in the second trimester and more in the third trimester.
And what are the causes of this kind of diabetes?
Diabetes is caused because of high blood sugar level, and it is caused by the placenta itself, that is the pregnancy itself. Actually, our fetus needs sugar, glucose to develop. So the placenta produces hormones like estrogen, progesterone, human placental lactogen, and cortisols. These hormones will cause insulin resistance, so that the mothers, though that blood sugar in the mother will reach the baby also. Not only for mother can utilize, that blood sugar will reach the baby also. So that insulin resistance will cause increased blood sugar level in some women who are prone for diabetes, that the pancreas may not be secreting enough insulin, or they are already genetically high risk or ethnically high risk for developing diabetes.
And why is it important to know about this diabetes?
Gestational diabetes is very important to know because this hyperglycemia or increased blood sugar level in the mother, it acts as a teratogen, that is, it causes problems for the baby more than the mother. Okay, so like in especially in India and all, the rate of stillbirth, the low birth weight babies, fetal growth restriction, and perinatal mortality, that is babies who are dying within 7 days of birth or 1 month of birth, is more. and it's mainly it is because of undiagnosed blood sugar diabetes in pregnancy, and that's why we are not knowing and we are not treating also, causing much of problems for the babies and the neonates.
And how to diagnose this diabetes in pregnancy, and who are at risk because of this?
Actually, there are lots of authorities internationally who have proposed lots of screening methods. And as you know, the gestational diabetes will not cause any symptoms in pregnancy. So we have to screen and find out who all are at risk. So the screening method is by giving glucose, extra glucose for the patient, and see how her body reacts, how her body controls the blood sugar. Okay, so screening test is done by challenging or seeing how tolerant our body is for the glucose we give. So usually there are two types of screening test. Okay, when the patient visits us, for the first visit itself, we are giving the patient 75 gram of glucose to drink. That in 1 glass of water, 75 gram of glucose is mixed, and she have to finish it in 5 to 10 minutes. And after 2 hours, her blood sugar level is checked. In that 2-hour gap, she should not eat anything or she should not walk around too much, so that it will not affect the blood sugar level. And after 2 hours, we will check her blood sugar, and it should be less than 140 milligram percentage. So if it is above 140, it shows that she have gestational diabetes. Okay, another method is by giving 75 gram glucose, and first we will take the sample fasting blood sugar level, and after that 75 gram glucose, and check blood sugar after 1 hour and 2 hours also. And the fasting blood sugar level in pregnancy is different from the general population. It is less than 92, it should be less than 92. If it is more than that, it's abnormal in pregnancy. It's not 110 or like general population. It is little more stricter in pregnancy. It should be less than 92 fasting level, and after 1 hour it should be less than 180, and after 2 hours it should be less than 155. Like that it is screened.
So it is very important to continuously check your blood sugar levels during pregnancy.
Yeah, first of all, we are screening for diabetes. First, we should understand that some women may have diabetes before itself, before pregnancy, and some will develop only after 20 weeks. So there are some women who are at risk, like in ethnically, like Asian and African people, we all are on high risk for diabetes. So and another, if our family members, that is mother, father or our siblings have diabetes, we are at high risk. Or in our prior pregnancy we had diabetes, we are at high risk. Such patients, and if BMI, we are obese, the patients are obese, then they are at high risk for diabetes. Such patients, not only in the first visit, they have to be screened after 20-24 weeks. And actually in India, they recommend even to screen after 34 weeks also. Because we are in India, Indians are 11-fold high risk for developing diabetes than other comparatively other.
Okay, that's very important thing that you have told, that Indians are like at high risk because of this.
Women should understand that it's not because of drinking glucose. Blood sugar is abnormal. Every patient, sometimes they will come and ask, doctor, they have given us glucose to drink and now it is elevated. That is why, no, it's not like that. We are challenging. A normal patient will not have high level of blood sugar even if she take glucose. Our body can manage. But only those who are prone for diabetes or who are already diabetic will show the abnormal value. And it's not because we are giving glucose. Many patients ask us, doctor, you already gave glucose and you are telling blood sugar is high.
Yes.
It's not like that.
Okay, that's very very good information that you have shared with our viewers, that it is we should go for the health checkups and maintain a good health. Dear viewers, here we will take a very short break and we'll be right back. Stay tuned. Dear viewers, we are back after the short break and we have Dr. Aisha with us sharing a very important information on diabetes in pregnancy. So Dr. Aisha, now we would like to know how it will affect, the diabetes will affect the mother as well as the baby.
Diabetes, because of the high blood sugar levels, as we have told before, the mother can have complications like more of infections, vaginal infections, urinary infections, and most importantly, she is at risk for developing hypertension, preeclampsia in pregnancy. That is, along with the BP, there will be secreting, there will be losing protein in the urine, and they are at high risk for developing that preeclampsia also. And the baby can have more size than the normal babies because of this high blood sugar, and obviously it will end up in having cesarean sections because of big babies, or even the ladies delivering vaginally, there is more chances for having vaginal tears and cervical tears and bleeding, postpartum hemorrhages. Okay, and even after a delivery, that more chances, even if it is cesarean, more chance for wound infections, and this hemorrhage is more for the mother. That's it. For the baby, because of this high blood sugar exposure, even before 7 weeks, by the time the baby's organs are developing, if the blood sugar is very high, there is a chance for developing congenital malformations for the baby. And it's mainly affect the baby's brain, heart. Actually, it is said that even 5-fold increased chances for developing heart malformations for the baby if it is exposed with high blood sugar, mother's high blood sugar. Then neural tube defects. And how diabetes affects the baby is more important because of this high levels of blood sugar. Baby is at risk for developing congenital malformations. It can affect the development of brain and development of heart, and it can cause, it is said that more than 5 times it is in high risk for developing congenital heart problems in the baby, and the neural tube defects also. And more than that, this baby, because of this high blood sugar in the mother, that sugar will enter into the baby's blood levels, and because of high blood level in the baby, baby's pancreas will start producing more insulin, and this insulin will cause more of fat deposition in the baby, and these babies will be generally bigger, maybe more than 4 kg, 4.5 kg, and associated with that, the babies will have to undergo more of metabolic problems, like after delivery. They even during delivery, because of the big size, they have to sometimes when there is a condition called shoulder dystocia, because the baby is big, head will come out vaginal delivery, but the shoulder will be stuck there. That condition is called shoulder dystocia. Then the baby will have asphyxia, and even the baby can die, or it can have shoulder bone fracture, or there is a condition called Erb's palsy. That's because of the nerve injury. When we try to pull the baby, it can have Erb's palsy. That is, baby cannot lift or use the one hand throughout. That is the problem. Another is after delivery, baby can go for hypoglycemia. Its blood sugar will come down immediately because of high insulin level in the baby's body. And mother is not supplying now, baby is alone now, and because of this insulin and mother is not feeding immediately, its blood sugar will come down, and baby will have seizures and respiratory distress, everything, and baby will need a neonatal ICU admission and all. And another complications we see are hypocalcemia and polycythemia. That is a condition because our RBC blood thickness will be more, and even it can cause seizures and stroke and all for the baby. All these complications people are not aware. All this happens maybe after delivery, and then we check for backwards, when check for the mother, then only sometimes we will diagnose. By the time we may lose the baby.
That's very crucial stage if it happens.
Yeah, and it is said that almost 50% of these mishaps, what is happening to the babies, it's because of the mother's diabetes, uncontrolled blood sugars. That is how much it is important.
So we have to be very, very careful
Yes,
to.
it is the babies who are suffering because of our lifestyle or.
Correct, absolutely, absolutely. So I think the expectant mothers, they should be more careful to go for regular health checkups to avoid any complications. Okay, doctor, now what important steps would you advise to avoid such complications?
Steps starts even before pregnancy. Actually, if I told no, there are some risk factors. You should understand. Ethnically, we are at high risk, being Indian or this thing, and if we are obese, family history is there. Before conception itself, our body weight should be maintained normal. Our BMI should be less than 27, and regarding another factors like lifestyle, we should change it before prior to our conception, and we should start folic acid. If we are, especially we are at high risk, it should be 5 milligram. Normally it is advised 400 microgram, but who are at high risk for developing diabetes, they should start 5 milligram before pregnancy. So the steps to avoid complications starts even before pregnancy. That is how we can give justice to our babies. Okay, and once we see that pregnancy test is positive, go to the doctor and do that OGTT test, which is I told na, we give glucose and see our blood glucose level, and if it is high, we should follow the doctor's advice. We should give, first of all, we will do what? If the blood sugar is high, we will advise dietary changes only first for 2 weeks. And the patient can go for a registered dietitian also, along with, actually it is called a multidisciplinary management, including the gynecologist, physician to control the blood glucose, and dietitian also. And we advise exercise. She can have 30 minutes a daily brisk walk or moderate kind of exercises every 30 minutes every 5 days in a week, and regular follow-up, and she will have that NT scan to see the anomalies which can be detected at 3 months itself. By aneuploidies, we can screen by NT scanning, and a double marker, there is a blood test from which we can see earlier itself the baby can have any chromosomal or any genetic problems. That we should do. That is a very important test to be done at 12 weeks of gestation. And another thing, we have to, for every depending after 2 weeks, if the blood sugar level is not under control, we have to start tablets, that is oral tablets, which is mainly given as metformin only, which is the safest medicine which is given in pregnancy for controlling blood glucose is metformin. And you need not have to worry about taking the medicine. Many patients are doubtful regarding starting the medicine. They will ask about the side effects of the medicine, but more than the side effects of medicine, the problems caused by high blood sugar level is more to the baby than the medicine. And this medicine, metformin, is vast studies have done, undergone so much researchers, and even up to 9 years after this delivery, these babies have been followed up, and they have not seen any problems with such babies. So you can safely take the medicine metformin.
So that is very important. Rather than to avoid taking the medicine, it is important one should have that.
And in case the blood sugar level is not controlled even with metformin, we have to start insulin. And also people are, as usual, they are worried about taking insulin. Why insulin injections like that? Will it cause any problem for the baby? But you should understand that insulin will never cause placenta. It will never, which we inject to the mother, it will never cause cross the placenta, or it will never cause any problem for the baby.
And what happens after delivery? Like once you undergo all these things, so after the delivery, what happens?
After the delivery means immediately after delivery, it is very important for the mother to be counseled regarding the breastfeeding. As I told before, the baby's blood sugar can come down immediately after delivery, and it should be breastfed immediately. And another thing, we have to check her baby's blood glucose for almost 1 day, that the pediatrician will do. Then if the baby is showing any other symptoms, we have to go for further checking for hyperbilirubinemia or other metabolic complications. And another thing we have to tell the patient is regarding her lifestyle, which is very important, and she is at risk for developing diabetes in her future. That is almost 50%. She is already at risk for developing type 2 diabetes in her future. That is within 20-25 years she will develop diabetes. So she should look after her lifestyle, and we should counsel her regarding contraception. There should be a spacing so that she can, before next baby, she can go for her blood sugar controls. And another thing is, after 6 weeks postnatal checkup, she should undergo a blood sugar level checking again, from where we can pick up the thing that whether the patient was only gestational diabetic or she had pre-gestational diabetes. Before itself she was diabetic. That is with the same test of OGTT like we did in pregnancy, we will do after 6 weeks.
Okay, now before we conclude our today's episode, so what advice or important tips you would like to share with the viewers and especially the expectant mothers so that they can avoid such complications? What advice you will share with us?
You should understand the importance of blood sugar levels in pregnancy, maintaining a normal level of blood sugar in pregnancy. And before conception, our body weight should be maintained normal, and take folic acid tablets. And if after conception, go to the doctor, do the screening test for diabetes, and follow the doctor's advice properly. Lifestyle and dietary changes you should make, and for routine antenatal checkups should be done. And you should understand the thing that we are responsible for the baby in our womb, and that baby is going to develop all those type 2 diabetes, obesity in the future because of it should not be like because of our problem that baby also should suffer.
Yeah, it is very important that we should be extra careful from the child's, like the baby's point of view.
Yeah, more. In case of diabetes, it is like that.
You are absolutely right, Dr. Aisha. We should be very careful regarding our health, and especially when it comes to our baby.
Yeah.
Baby's point of view. So thank you so much for coming to our show and sharing your valuable information and giving important advice to our viewers and especially the expectant mothers. I think this will really help them in many ways. Thank you so much once again. Dear viewers, it is important to manage gestational diabetes because it can affect both you and your baby. On this note, we conclude our today's episode. This is Meenakshi Sharma signing off for this evening. Till we meet next week, same day, same time. Take very good care of yourselves and your loved ones. Stay safe, stay healthy, stay happy. Good night.